It's another day with the physicians where your health is our business.
Growth spurt the end. So you are not going to take some drastic measures. But a 10-year-old tummy, pressure is high. But also to know that not only when your pressure is high that you have glaucoma.
Sugar, and I don't know about any other one, but what
You're welcome back to the joining us on your regular program. World Breastfeeding Week is celebrated every year from August 1st to August 7th in more than 170 countries to encourage breastfeeding and improve the health of babies around the world. Breast milk is the ideal food for infants. It is safe, clean, and contains antibodies which help protect against many common childhood illnesses. Breastfeeding is one of the most effective ways to ensure child health and survival. However, nearly 2 out of every 3 infants are not breastfed for the recommended 6 months, a rate that has not improved in decades. On your regular health TV talk show, The Physicians, we will take a deep dive on this year's theme, Protect Breastfeeding, a Shared Responsibility. Welcome back. If you're just joining us, this is The Physicians, where your health is our business. I remain Dr. Memuna Yusuf Kadri, and of course, with me always
is Dr. Maxina Agbere. Welcome to your regular program, The Physicians, where your health is our
business. You look lovely, by the way.
Thank you. You too.
Yeah. We are looking blue, but not feeling blue.
Well.
Yes, I understand, yes. You're looking blue, but not feeling blue.
It's not good to feel blue.
It's not good. If you are feeling blue, find out what it is and deal with it, right?
Sure,
that is why this topic is even important and is linking to everything regarding that particular statement. It's Breastfeeding Week. And we're not just talking about breastfeeding because we've talked about it over and over again in this on this program, but this particular theme for the year, shared responsibility. It means no, we are not just going to be competing for gender equality, inclusion, diversity. How can breastfeeding be a shared responsibility? If you are married, with your partner. If you are not married, support from your family members, because it ain't easy.
That's exactly what it means.
6 months.
Responsibility simply means it is not the responsibility
of only the mother. Yeah.
It's actually for everyone. You need to support the mother. Not after 9 months of pregnancy, carrying the baby, then you have your child. Breastfeeding again. You must have support. The support system is very, very
that
important.
takes us to that. Even if you are not from that part of the country, that word is now resonating with all of us. Omugo.
Yes, Omugo. Because some people look at Omugo as something else.
You're right. They see it as a burden. Some people see it as a burden.
So talk about Omugo. When they go, do they really do that Omugo work?
I remember talking to a group of employees regarding things like this, but it was narrowed to depression and how important it is, helping your children when they now get. Do you know the men in the group like, as if they had a meeting before I came. Meanwhile, it was what has been in their minds for years. So when I just brought up the fact that, mothers, when their children have babies, because of these risk factors, vulnerability risk factors for depression in women, mothers, the fathers just stood up. No, don't even go there. So are you trying to say that we'll be abandoned? This time, the revolution is not only Beijing. We'll be following our wives to go for Mugo.
When you do what will they be doing?
Let me tell you, what are you talking? You didn't even allow me to learn. The men said they will fetch water for them to be using. If a baby, their daughters are tired, they will help to carry the baby.
There's something underneath.
It's a discussion we need to.
We actually need to look at it.
Well, we even have an expert that will deep dive into it because she's a pediatrician. She's also a mother. She had experiences to share with us with regards to this. Protect breastfeeding, a shared responsibility.
But what something you said in the introduction, actually beats me. 2 out of 3 infants are not breastfed.
And we're 2021.
Yes.
There must be a reason for that.
Well, we'll find out.
There must be a reason. Our daughters now.
Baby mamas.
Don't go there. Don't go there. We'll be right back after this time out. Welcome back. This is your regular health TV program, The Physicians, and of course, where your health is our business. On today's program, we'll be talking about Protect Breastfeeding, a shared responsibility, which is a theme for the World Breastfeeding Week. And in our studio today, we have a very amazing expert, not only an expert, but also a mother. She is no other person than Dr. CHINYERE UZODINMA, a consultant pediatrician and founding medical director, Excel Hospital. Dr. CHINYERE, you're welcome.
Thank you. That's
nice having you.
Thank you so
nice
much.
having you. You look brilliant and look amazing. The lips are like, you know,
Thank
talking about
you.
breastfeeding.
breastfeeding and then.
It's exciting, you know.
Welcome, Dr.
Yeah,
CHINYERE.
thank
So
you.
now, I think before we even deep dive into the theme for this week, let's hear your experience as a mother and of course as an expert with regards to breastfeeding.
Right. I must begin by saying that breastfeeding is a very, very important factor for child survival. In fact, it is the most important factor for child survival once the baby is born, because it has everything to do with nutrition and good health in the newborn baby. That's from my point of view as a pediatrician. From my point of view as a mother, you know, you know, being a pediatrician, you know, and what I've been speaking about all my life, you know, I knew that I had to do it, and I had to make an example of it.
I think if most people know the importance of breastfeeding and there's advocacy, they understand it, they will actually wait and want to practice it.
Exactly.
Because if you didn't have that knowledge, you probably won't have taken it really seriously, okay?
Yes, yes.
Now that also you are a doctor, you also understand the benefits of breastfeeding.
Exactly.
Yeah.
So when you are preaching, you need to talk, walk the
talk.
Yeah,
Exactly.
walk the talk. Like telling people,
You get it.
I did the same thing for 6 good months, exclusive breastfeeding.
Yes,
For my 4
that's it,
children.
that's it.
Not water. My child tasted water on the day he clocked 7.
Yeah.
That's it for me.
That's it.
All my 3 kids.
That's it.
And
That's it.
it's just like not just talk the talk, but walk the
That's
talk.
it.
So these children will really be free,
Exactly.
and it paid off because I didn't visit any
You
pediatrician that
don't
period.
visit a hospital for the
Yeah.
first 6 months.
If the
that
child
you're
doesn't
doing
even
exclusive.
move the ball, you won't even be scared.
Yes.
Exactly. And the bonding is so much.
So let's talk about the theme for the year.
Okay, yeah.
Protect breastfeeding, a shared responsibility.
Yes, this is a very important theme for this year 2021. Very, very important theme, you know. Breastfeeding is a shared responsibility. And why is that so? Because every woman needs to be supported to exclusively breastfeed. And I want to emphasize here, we're not just talking about breastfeeding sometimes. We're talking about the ability of a woman to breastfeed exclusively for the first 6 months of life. And what does exclusive breastfeeding mean? It means giving the baby breast milk only for the first 6 months of life. And when I say breast milk only, no water, no formula, nothing else. Breast milk is water, breast milk is formula, breast milk is everything.
Medicine,
everything for the first 6 months of life. That's exclusive breastfeeding. So we're saying, in this world of today, mothers are very busy, and talk about Lagos, people leave their houses by 5 a.m., 6 a.m., return back late and all that. So the mother needs to be adequately supported in order to be able to carry on with exclusive breastfeeding. And what are we talking about in this support? We're talking about the immediate family, the partner, the family, the entire family, the mother or the mother-in-law or the sisters or the neighbors, the people in the workplace, social support around the mother. And then I think the most important factor actually is also the workplace. Because you find out that for some employers, a woman breastfeeding, they think that the woman takes a lot of time off work or may come in late and all that. But one way to address it is for employers to create a place in their workplace so that breastfeeding mothers can actually have some time off in between work to breastfeed their babies.
Okay, so for mothers that have challenges, because it's not only about the breast milk. What other ways do you think they can support the woman? Because a mother who just had her baby, breastfeeding the baby, after that will do the washing of the nappy, everything, still go to the kitchen to cook. In what way do you think the husband can support?
Fantastic.
Also waking up at night, the woman is breastfeeding and the man is very busy sleeping. Then in the morning he wakes up and tells you that breakfast is not ready.
Sometimes move to another room. So that they don't get
but that is not so.
Sometimes move to another room.
Yeah.
So this is what I talk about every day in my clinics, you know. So what we're saying, and what I say to mothers really, is when you're breastfeeding, for that first few months that you're at home, you don't have to do anything else. Breastfeed, let somebody else make your food, let somebody else do the house chores. Don't go sweeping, don't go to the market, don't go shopping, don't go do anything.
But this is I'm very serious. This is the ideal. This is the ideal.
But it's not our reality.
But that's why we're here. It's a shared responsibility.
Okay, that's true.
That's why we're here.
Are we telling the mothers this or the support?
We're selling the support team. And that's why when mothers are visiting the hospital, their partners should come with them.
Very key.
Very key. Because they need to hear it from the doctor's mouth. There are a lot of benefits from breastfeeding. And we're even talking about a smarter child in the future.
Yeah.
A very smart child, because breastfeeding does what? Helps with good brain development. So you, at the end of the day, you have a child who is smarter, a child who is healthy, a child who is doing well in future. And you have the opportunity to reduce hospital visits in the first 6 months. In fact, you don't have anything to do with hospital.
I want to ask something that just came to my mind now. Now, because we talked about 2 out of 3 infants born are not breastfed within the first 6 months as recommended. Now we have an increase or a surge in baby mamas. So what do you think is going to happen? And most of them really are not, they don't really want to breastfeed the babies.
They are scared that their breast will sag.
There's a whole lot going on. They don't want to breastfeed, so we said they don't want to go through labor.
Through labor, yes.
So they already have planned CS. So what do you think is going on? How are we going to cope?
And some of them don't want to be tied down to by the task of breastfeeding.
Breastfeeding, yes,
They just want to drop the baby.
Drop the baby and move on.
So
yes.
what can we?
But what I would say to those people is, there is a way out. And what is the way out? If you have adequate support around you, your life goes on. But please, just express the breast milk. Somebody else can do it.
Let's hold it there. We're talking about baby mamas, reason why they are no longer breastfeeding, and of course, even going for elective CS, once baby is out, take and move on. but you are not telling us how they can even breastfeed regardless. We are going to the street with keeping up with the physicians.
Breastfeeding is simply the act whereby a mother puts a baby to breast.
Okay, it's very beneficial for a woman to breastfeed.
Yes, I believe breastfeeding is a shared responsibility because a woman needs all the support that she can get.
Raising up any child should be a collective responsibility.
It should be a shared responsibility to everyone in the entire world.
They should be able to help out in other activities at home so that the woman focuses on herself, eating healthy, eating well, and breastfeeding her child, because stress is a factor that can reduce the amount of breast milk that a woman produces.
To help, aside from encouraging her and providing support, I think you should also help in the home front.
It is only fair that at those regular hours, at those regular times when she needs to give attention to her baby, to give exclusive for the baby to be well breastfed, the husband can take the bull by the horn.
For example, some people feel that if they breastfeed their child, that their breast is going to sag, or that 6 months is too long.
We have women who are not just housewives, who have women who work.
In the workplace, they should be able to provide a place where people can go and breastfeed their child. They can take like short breaks to go and breastfeed their child.
Sensitization, and more sensitization.
Providing support. Encourage your wife, encourage your sisters, your mother.
I'm sure you are excited the way I am, hearing from the people in the street and of course what they are talking about breastfeeding. This shared responsibility thing, I think is going to be an agenda in our next constitution, so that people will get to know that it is important and we need to nip it in the bud. The children are our future, our legacy, and we need healthier children for a sane society. Before we went on break, we're talking to Dr. CHINYERE UZODINMA, our guest expert in the studio, a pediatrician and the founding medical director, XF Hospital, Children's Hospital, and she was talking about the importance of breastfeeding when it comes to baby mamas just dropping their children and not wanting to breastfeed.
Yes, and maybe if they know why breast milk is so important, then they will be able to key in. So let me just maybe list out some of the benefits of breastfeeding. Now, breastfeeding does not only benefit the baby, it benefits the baby, it benefits the mother. So it's a win-win for everyone.
Even the society.
Even the society. So for the baby, what are we talking about? We're talking about the first good footing for the baby in life. That colostrum. That first breast milk that comes out, that is very yellow.
Liquid gold. Liquid gold.
Thank you, So it's a golden one, really, golden in terms of value. Why? It is very rich in protein, and it's very rich in what we call immunoglobulin A, IgA. So what happens is that those proteins, that immunoglobulin tends to coat the intestines and make sure that bacterial organisms don't find a way through to cause any infection in the baby. So you can see why I say it puts the baby on the right footing right from the start. And subsequently, breast milk contains adequate quantities of calories, protein, and other nutrients that the baby needs to stay healthy. Now, you can get carbohydrate from infant formula, but you can't get those antibodies that protect against infection from the formulas. And what infections are we talking about? We're talking about infections like pneumonia, cold, catarrh, ear infections, diarrhea, a whole lot of them. So what are we saying? We're saying that your baby is going to be healthy if you are breastfeeding. And then talk about what? Talk about the brain development. Breast milk has been found to be very beneficial in cognitive development of the baby. Some mothers go into the pharmacy and they're shopping for drugs. Which one can make the baby's brain to develop well? You don't need to go far. Just give your baby breast milk and you will see a child who is bright and growing up very well. Now talk about the mother. When you talk about the mother, there is immediate benefit from breastfeeding. to the mother. The first immediate benefit is something that everybody wants to jump at. And what's that? It helps the uterus to go down.
Go down.
Immediately.
Get your snatch back body.
Exactly, yes. Because when you are breastfeeding, the process of lactation stimulates what we call the oxytocin. And that oxytocin helps to contract the uterus. So you find out that for the fact that a woman breastfeeds, the uterus returns to the normal size faster and quicker. And again, another immediate benefit is that it also reduces the risk of bleeding after delivery. And that's why we say every mother, once you put your baby to breast, the hospital must hand your baby over to you so that you can breastfeed immediately within 30 minutes of giving birth to your baby. Let your baby suck. That's the best approach. As you're doing that, the uterus is contracting and the risk of bleeding soon after birth is significantly reduced. Then talk about the important diseases that it reduces in the mother's life. It reduces the incidence of depression, postpartum depression in the mothers. Why? Because those hormones also help to give you a very good mood, you know. And then talk about a list of other diseases. Protects the mother from diabetes, type 1, type 2 diabetes, reduces the incidence of those diseases in the mother, the incidence of breast cancer in the mother, the incidence of endometriosis, and a host of other diseases that it cuts out for the mother. So what are we talking about? We're saying that you can either directly breastfeed your baby or press out the breast milk into a cup, and then that breast milk can be given to the baby by anybody else. And how does it work? Your midwife or your doctor will put you through the process of expressing breast milk. There are machines to be used: electrical breast pump, manual breast
Even
pump.
your hand.
But you can also use your hand to press it out. So you don't have to go to market really. You can also use your hand to press it out. And in fact, you'll be amazed at how you can fill bottles, you know.
I did it now.
Yes.
Especially if you lactate much.
Yes.
It's almost like shower.
Exactly. So you're able to fill up your bottles, fill them, and you know the good news? Once you do this, you can cover them up, label them with their dates, and put them inside your freezer. So you can use it, you can bring it out anytime.
For how long can you? How long can it be?
You can actually keep frozen breast milk for up to 3 months.
Wow. What up? Don't lie.
Yes, that's true. That's true. But if it is frozen, most times things that are frozen in the freezer don't get stored. Yes, they stay longer.
So I know, because I know our time is fast spent. I want to also ask this for people that probably the woman passed on at delivery and the baby is left alone. How do you support those kind of children?
Okay, well, is a counseling, you know, because maternal demise soon after birth is also a very important factor in neonatal survival of the baby subsequently. So talking about feeding, the baby may still be able to benefit from breastfeeding 2 ways. Some countries have started what we call breast bank. Breast milk bank. So you can actually get breast milk from the bank. The only thing is that the donors of this breast milk would have been screened for important diseases and are confirmed to be free from them. But here we don't have breast milk bank locally here. But also, if there is a relative like the woman's mother can relactate. So there's something that's called relactation. Any woman who has lactated before, who has breastfed before, can begin to lactate again if she puts a baby to breast. But the most important thing again is the woman has to also be screened to make sure that the woman is healthy.
I totally agree with what you just said, because once I was in the clinic and I visited a friend in clinic and I saw this young girl with a grandmother. She had twins. And before I knew what was happening, the grandmother was breastfeeding the other child. They asked and they said yes, that the girl is young and she's unable to cope with it too. So the grandmother usually assists in breastfeeding. So the grandmother breastfeeds one and the young girl breastfeeds the other.
That's what we're talking about, shared responsibility. Finding what you can do.
It's a good thing for the year.
You can see that the will is there. So some people are just saying, I can't do it, I can't do it. But if you have the will,
you find a way. Thank you once again, Dr. CHINYERE UZODINMA.
So
and we are hoping that when we call you next time, you'll be able to, share with our viewers, because you are a fantastic health educator.
Yeah.
To our viewers out there, you've heard it all. Breastfeeding is not just for the mother alone. There are loads and loads of benefits for the mother, for the child, and of course for the society. And that shared responsibility from you is very key. Once again, I thank you very much. And my co-host, Dr. Martina.
Yes, I have to say something about this because that's very, very, very important. For mothers out there, I've heard it from the experts, the colostrum, the first milk that comes out, is very, very important also. It's called the liquid gold. Even though some people call it the devil's milk. It is not the devil's milk. It is the liquid gold. It is very, very important. Do not discard it. Ensure that the baby gets that first breast milk. So on this note, thank you so much.
I remain Dr. Memuna Yusuf Kadri,
and remember to follow us on social media platforms, on YouTube, Instagram. And of course, if you want to be a part of this program, you're just a click away. Just send us an email and you'll be invited here. I am still Dr. Martina Agbere. See you next time.
My name is Dr. Oladapo Ashinyobi. I'm a member of the Association of Public Health Physicians of Nigeria, Lagos State Chapter. Keep watching The Physician.
And some other people, they may have itching, either in the nose, some in the throat, or even some people watering of the eyes. And